tract infection can occur in anybody at all. Then there could be urinary leakage, there could be painful urination. Then because metabolism slows down and there might be weight gain. Now we know that diabetes has to do with how the body uses food. So when that is affected, especially sugar, then if the person already has other risk factors for diabetes, diabetes may set in or the diabetes may get worse. There could be high cholesterol, there could be belly fat. Generally, belly fat attracts sugar in that it makes insulin less active. So belly fat generally can also predispose to diabetes. So there's a relationship there. There mood and sleep changes. Some people might have what we call depression. Some people become anxious. They sleep less. They sleep poorer, and sleep might just be distorted. Then the bones are likely to get weaker. And when the bones are weaker, there's higher risk of fractures occurring. So those are the things that may affect our health during menopause. Not all, but most common. Now, how do we manage menopausal symptoms? The first thing we want to do is we want to minimize the risk, and then we want to treat. Let me say that those symptoms vary with the individual. Some people may not have, some people may have very few of the symptoms, and some people may have more of the symptoms. I might use myself as an example. I had first menopause because I had to do a hysterectomy, but I didn't have much to contend with. I mean, just please God to let it work like that. So I didn't have many symptoms despite my first menopause. So how do you minimize your risk during and after menopause? It's important that we eat healthy. Healthy eating helps us with almost anything in life, actually. So it's important that we eat healthy and we eat balanced meals. It's not a time to say you're going off this, going off that. So we might also need a dietitian to help us, but we should eat healthy, balanced meals. It's also important that we stay active. The value of exercise cannot be overstretched. Exercise helps in preventing so many diseases, including cancers. And it also helps us to minimize our risks. Because you see, these risks are interwoven. For example, now, if you reduce your risk of getting hypertension or heart disease, then you have reduced the likelihood that in menopause you will get it. So exercise helps. Do your checkups, very important. And I think that's another thing, culture that we need to build. We should not wait until we're not well to check our numbers. Our numbers include our blood pressure, blood sugar, our cholesterol, that's lipids. We call it lipids, even though generally they refer to it as cholesterol because there are so many things that come to play in there. And as we go along, we'll see why. Then we can also measure what we call our bone density. There are some machines that are used to measure it because that will also help us to know if our bones are getting weaker or not. Then we should get enough sleep, very important. And I think many of us are guilty there, especially as women, because we want to do everything. We want to make sure that everything is in place. We are the last to go to bed. We are the first to wake up. Sometimes in the night, we are waking up to check the children that nothing is wrong with. So it's important that we take care of ourselves. Let's get enough sleep and manage stress. Stress is inevitable, but we can manage it. We can minimize it. Then we should discuss with our doctors about what we call hormone replacement therapy or menopause hormone therapy if it is needed. That's also important. So if we think that we need that, we should discuss with our doctor. So we'll go into treatment of menopausal symptoms. When we're looking at that now, the treatment has to be considered in terms of what the symptoms are that we're experiencing, And then who is experiencing these symptoms? And I will explain. For example, if somebody needs to take probably let me make it simple. Somebody probably has some pain and needs to take some pain medication. Now, we must consider other conditions that that person has in the choice of that pain medication. That's why I'm saying that we have to look at the symptom, we have to look at the individual. It's also it also cuts across other risks. For example, now if a woman is at risk of developing breast cancer, then we might also consider the drugs that we want to use. It won't be a drug that also has the risk of causing breast cancer that we now use for such a person. So the symptoms, yes, we'll consider that. We'll consider the individual as well. So another factor that we will consider in our treatment choice when we are doing treatment is, do we want to use medicines? We call that pharmacological intervention, whereby we use medicines. Or can we solve it using non-pharmacological interventions? That's using lifestyle modifications. Maybe it's a lifestyle that we need to modify, or we need to use alternative therapy like yoga and things like that. So those are things that affect the treatment choices. Or if the person is not eating healthy, wants to um, change to healthy options and things, and then alternative therapies like yoga and the likes. Now, use of medicines. I've classified them into two. We have what we call the over-the-counter, those ones that we can buy without prescriptions, like herbal supplements, vitamins, moisturizers, and then prescription medicines. Maybe I should pause a little here to also say that many times when we're going through menopause, because the symptoms are like malaria, a number of us take the laws into our hands. We just conclude that it's malaria and then we start treating malaria. Some people it's worse because they will add typhoid to it. In this country, I keep saying that if malaria could sue, malaria would have sued so many of us because we blame things on malaria and typhoid. So it's important that we don't just rush to get medications. It's important that we try to understand what is happening to us, seek counsel. Because at the end of the day, every medicine that you put in your mouth is a potential poison. Please note that. Because once you have put it in, you throw it in, you swallow it, or wherever it goes in, you don't know what happens to it anymore. You are not in control. You don't decide what it does. It decides what it does. So we must bear that in mind, and let's not be in a hurry to just swallow pills. Let's find out, even though they are called over the counter. So for this presentation, I deliberately brought out at least two of the herbs for us to look at and objectively, and we'll make up our minds what we want to do. So there could be vitamins as well. Vitamins too can have overdose. Please, vitamins can be too much. Vitamins are not necessarily innocent. So prescription medicines are generally called hormone replacement therapy. Now let's look at herbal supplements that are commonly used for menopause. We have things like kidney primrose oil. I'm sure some of us have heard about them before. Blackwash, Angelica, ginseng, St. John's wort, red clover. These herbal remedies contain some of them, like the um, red clover here, contains hormones that can act in ways similar to estrogen, and something like blackwash is believed to balance estrogen and progesterone. So this may help with some menopause symptoms, but they are we don't have enough scientific evidence to back these things up. The major problem we have with herbal remedies is that not much research goes on with them. Sometimes what we have are just testimonies. Science, orthodox medicine does not work with testimony. You must go beyond all reasonable doubts to prove. They go through different kinds of trials before they come to conclusion. They do evidence based. Even while the drug is in circulation, it's being monitored, research is ongoing, which is hardly the case with herbal remedies. Herbal remedies, they are good. I won't say they are bad, they are good, but sometimes we don't have enough evidence to support their use. Sometimes we don't have enough evidence for their side effects and what can go wrong. That's why for some of us conservatively, we go with what we know. Let's look at our popular evening primrose. This I got from a website that I subscribe to. It's called Natural Medicines. I know they've changed their name recently now. I'm trying to remember their new name. But it's a website that you pay a lot of money to access, and they back whatever they say there with a lot of research, albeit they still put their disclaimer that you have to take a final decision by yourself. So people use evening primrose oil for premenstrual syndrome. They use it for menopause symptoms. They use it for arthritis, high cholesterol, acne, and many other conditions. But there's no good scientific evidence to support these uses, but then we use them. Now, for some of these herbal products, if their safety profile is good, I don't mind using or recommending because it may work, it may not work. But when their safety profile is not very good, then we must be careful. I mean, what I mean by safety profile is what they can do. If we're not sure of how safe they are, then we may not want to risk it. And let me illustrate that a little. For example, you are in Lagos, you want to buy meat worth 10,000 naira. Yeah, meat is cheaper in Ibadan. Would you run all the way to Ibadan to go and buy the meat? No, you won't. You wouldn't. You would rather buy it in Lagos. But if you are buying cows now, you could decide to run all the way and take that risk. Now, when taken by mouth, even primrose oil is likely safe for most people when taking doses up to 6 grams. Thankfully, most of the ones we have out there are 500 milligrams, that's half of a gram, and 1 gram. So that means that if somebody even takes up to 6 of the 1,000 milligrams, which is 1 gram, daily for up to a year, they are just safe. It might cause mild side effects such as upset stomach, nausea, diarrhea, headache in some people. But let's look at some special precautions here. In pregnancy, taking evening primrose oil by mouth is still just safe. Taking up to 4 grams daily for up to 10 weeks seems to be safe. But until this is confirmed, let's be cautious. That means it's not yet confirmed. But so far, what uses a pregnant woman to test if a drug is safe or not? All we just do is we look at pregnant women who have taken that particular medication to see what has happened to them. So they don't do clinical trials with pregnant women. And that's why it's difficult to say categorically. But from evidence that we have seen, it seems safe. Taking evening primrose oil during the last weeks of pregnancy might delay labor. So we should consider that. Don't use this product close to the end of pregnancy. I'm just citing this as an example. Of course, we are not pregnant here now when we are looking at menopause. Though during the transit phase to menopause, some people might get pregnant. So maybe it's still useful to us. I'm using this to illustrate why we need to be careful with drugs generally. Now, in children, it's also been found to be fairly safe. Now, a caution here. Evening primrose oil might increase the chance of bruising and bleeding. So if you have a bleeding disorder or you're on medications that thin out blood, then you should be wary of using evening primrose oil. And many women might be in that category. They already have cardiovascular diseases or so, and they're on blood thinners, then be careful. Then it's also been found that evening primrose oil might make seizures more likely in some people. So those who have epilepsy or seizure disorder, no for evening primrose. If you are preparing for a surgery, evening primrose oil, there's a difference between evening primrose and evening primrose oil. Evening primrose is the whole plant. We're talking about the oil now. We don't know much about the other parts of the plant, so it's the oil. Now, using that oil, thins out blood. So if you are preparing for surgery, please stop using it at least 2 weeks and let the person who want to operate on you know. You find that some people bleed profusely after surgery. It might be because they're on products like this that thin out their blood. Evening primrose oil might slow blood clotting and increase the risk of bleeding. Taking it with other supplements that have similar effects might increase the risk of bleeding in some people, even if those are supplements. Supplements like ginger, garlic, ginseng, all the G's, they thin out blood. So if you're on any of them, you may be careful not to add evening primrose to it. Evening primrose may also interact with some other medicines. So if you must use evening primrose, please discuss with your pharmacist so that you get the right information. This is another popularly used herbal remedy for menopause, and it's called black wash. And people, it's said here that people commonly use it for symptoms of menopause, premenstrual syndrome, painful menstruation, weak and brittle bones, and many other conditions. But there's no good scientific evidence to support most of these uses. However, for this particular product, we have some safety issues that we'll look at later on. It says it's possibly safe when taken by mouth for up to 1 year, but there are concerns about it damaging the liver. Then it may interact with some medicines. For example, if you are on any product called atorvastatin for cholesterol, black wash may interact with it. So let's look at special precaution, no for in pregnancy and breastfeeding. If you have breast cancer or at risk of breast cancer, then that product won't be for you. Then some other hormone-sensitive conditions like endometriosis, fibroids, ovarian cancer, uterine cancer, black wash may be a problem there. It may be a concern. If you have liver disease, then black wash is not for you. If you're not sure whether you have it or not, don't go near it. Let's look at menopause and vitamins from a research work published in PubMed. There's evidence that if we balance our supply of the B group of, B, when we talk of B, there's so many of them, B group of vitamins, C, D, and E. If we balance them properly, it might contribute to ameliorating the quality of life in menopausal women. So if we have supplements that have been well made and the vitamins are properly balanced, they might help. Another thing that we might need to know about herbals is that by the time they make them into capsule or tablets, sometimes there are compromises. It depends on where they are produced. Those might also affect what they contain at the end of the day. So there are so many issues around them that we need to be careful with. So if we are going to go on any of those herbals, for those of us who are in Nigeria, it might be safer for us to use those products that have been registered for use here, or at least registered for use in the country where they are bringing them from, and we're sure. Now, let's look at other products that might be useful in menopause that are available over the counter. One of the most common conditions in menopause is vaginal dryness. So we might, many of the vaginal products, moisturizers, lubricants, they are over the counter. For example, I know we use KY jelly. KY jelly is available here. Replens is also available. These are moisturizers that are put into the vagina or around the vulva daily or as recommended. I know with Replens is about once in 3 days thereabouts. And what they do is to keep the vaginal tissues healthy, and that way the pain that is experienced during sexual intercourse is reduced or absent. Then we can have vaginal lubricants. Those lubricants are applied on the vagina or on the vulva or sometimes on the penis just before having sex. to ease pain during intercourse, and they can be used in combination with vaginal moisturizers. Now, let's go to prescription therapy. These are drugs taken to replace the estrogen the body stops making after menopause. They might be used to treat common menopause symptoms such as hot flashes and vaginal discomfort. They've been shown to prevent bone loss and reduce broken bones after menopause. But the issue is that they have their risks, and these risks depend on the type of hormone therapy that we are looking at here. It also depends on if this medicine is taken by mouth or applied on the skin. When it's taken by mouth, the risk is higher than when it's applied on the skin. The dose of the medicine too matters because the higher the dose, the higher the risk that something might go wrong. For how long the medicine is taken to naturally, the more you are exposed to the medicine, the more the likelihood that something can go wrong. Then age at which we are being exposed and our personal health issues, like we said, there are some people that they already have a lot of risk factors for heart diseases, and then you want to add some other risk. Or some people, we, any family where a female has been diagnosed for breast cancer, the immediate relatives are at risk. For example, if it's a woman, the children, the female children, and the sisters, they have a high risk of developing breast cancer. So for people like that, you may not want to use a kind of hormone therapy that could also be a risk factor for breast cancer. And that's why management or treatment, drug choice has to be individualized. The doctor for this prescription therapy, they must be prescribed by a doctor, and the doctor would get to know the patient, get a lot of information, find out your medical history, your social history, a lot of history from you before they arrive at the particular one that they want to use for you. For example, like I said, I had early menopause, I had hysterectomy. Now, without uterus and with uterus, there are differences in what we get with the medication. So the choice of drug for somebody whose uterus has been removed is different from the choice of drug for somebody whose uterus is still in there. And whatever choice has been made should be regularly reviewed from time to time to ensure that the benefits that we are getting from this drug outweighs the risk. In medicine, that's very key. We look at risk benefit ratio. Where the benefit outweighs the risk, that's when we want to move. Now, let's look at, let me summarize with our take-home points. Menopause occurs naturally. It's not a disease, it's just normal. And natural pregnancy does not occur after menopause. Some people might have bleeding after menopause. Please don't joke with it at all. Report it. It may not be anything, but more often than not, there's something wrong. And the thing is better arrested promptly. Permit me to digress a little. There was a time a woman who had menopause for many years, and she had very early menopause. She actually wanted more children. So when she started bleeding, she was happy with herself that her cycle came back. And she came to meet me. I said, no, please go to the hospital. Thank God that she listened. She went to a teaching hospital, precisely Luth, and they were so happy that she presented early because it was a case of endometrial cancer, and they took out the cancer. And I think that happened well over 10 years ago. She's still doing very great. So don't joke with it. It might be a symptom that something is going wrong somewhere. Then menopause symptoms vary per person. Please note that you have a role to play in the prevention or management of some of your menopausal symptoms. So you have a big role to play. Please be at the driver's seat of your health. Herbal supplements, vitamins, and prescription medicines are tailored to the individual and may harm if used incorrectly. Please discuss with your healthcare professional. Your pharmacist, because that's our core training, medication use, will help you to assess the correct medicine information. Now, let me say here that the information I provided here today is just for learning purpose and it's not intended to replace your doctor's advice. Thank you for listening. Glory to God who created us to be women. We are wonderful, wonderfully made. I may
Thank you
take your
very much
questions
for
now.
that
Yeah.
very educating and insightful session. Thank you so much. If you have any questions for our guest speaker, can you please put it on the chat box so that we could ask her these questions? We have just a couple of minutes to go about that. So, very quickly. But let me ask you some of the questions that I've had. You've actually answered some of them with um your lecture today. So, the first question that I would ask is what are the most commonly prescribed medications for menopause and how exactly do they work on the body?
Okay. Can you still hear me? I'm not more saying this
Yes, I
screen.
can hear you.
Okay, thank you for that question. Like you said, a lot of them have been addressed. Most of the prescribed medications are to replace the estrogen, and that's why they're generally referred to as hormone replacement therapy. So, they work to replace estrogen generally, so that there's a purpose to alleviate some of the symptoms. Sometimes some drugs are to take care of particular symptoms. For example, those who have depression, they might be on antidepressants. But like I said, because this is very important, the choice of the antidepressant will also depend on the patient. Who is this person that we are talking about? How old is the person? There are some antidepressants that may not suit people at a certain age because of the age. Some drugs are also prescribed if there's incontinence, for example. You might also need to put the patient on medications that will improve continence, that will make it easier to hold urine. And even those ones to have different types for different ages. Okay, let me just put
Okay,
it
thank
there
you
for
very much. Now, first question from the comments from the chat. Do vaginal moisturizers have side effects?
well, generally, we don't say no, no, no to that because everybody is different. If you have itching or something, burning sensation that's unbearable, then it means you need to stop using it. But it's generally well tolerated. Generally well tolerated. Generally.
Okay, the second question is excessive bleeding and irregular cycle part of menopause setting in?
It's what?
Is excessive bleeding and irregular cycle, are they part of, or are they signs of menopause setting in?
Well, not necessarily, but when menopause is setting in, cycle can be irregular because of the estrogen that is low. But excessive bleeding can be a sign of fibroid, and that's why it's good to get medical attention.
Okay, next question is what recommendations do you have for sleep? Something natural, not necessarily drugs.
For sleep, did you say for sleep? There's a lot and a lot. And I know there are sleep therapists that don't use drugs for us to sleep. So it depends on what has been identified as a cause of our not sleeping. If it is that you're overworking yourself, then you need to work on that. You know, there's what we call sleep hygiene. Some people don't just know how to go to bed early. Some people might need to put off the lights to get their sleep. Some people need to have their bath at night to get their sleep. Some people might need a very quiet place to sleep. Some people might need to do probably a little bit of reading something interesting to sleep off. You just need to understand yourself within your that context. And if you cannot help it, then it might be good to see a sleep therapist. Fortunately, I'm not one, so I can only do a little bit of advice. So if you
Okay.
are not sleeping well, find out why you are not sleeping well, first of all. Then we can walk through from there.
Okay, thank you very much. The next question, person says, for years I've been having hot flashes, but it stopped and then insomnia continued, and recently dizziness sets in. What should I do?
It should be nice to see your doctor so that we're sure what the real problem is. Like I said, many times we don't come up with the right diagnosis, and that may be a problem because of flashes means you feel some people describe it as internal heat, especially the upper part of the body. They're more commonly at night and things like that. So hot flashes, yes, is a symptom of menopause, but some people might have something that looks like hot flashes that is not associated with menopause. So it's good to find out, please. Talk with your doctor or healthcare professional so that you are looked at holistically to be sure what the real problem is. Especially now that you said it's associated with dizziness.
Yeah, thank you very much. Next question, is having numbness on one's finger while sleeping and then it disappears when you're awake part of menopause symptoms?
Well, I'm not sure of that, but I know that depending on your sleep position, that can occur. That can occur if you sleep in a way that disrupts blood flow to that part of your hand or body. You may have some numbness there. And then when you adjust, the numbness goes away. So that might just be a positional thing when we see.
Okay, thank you. Another question. For a woman who has had partial heterosectomy, where does the sperm go during intercourse?
Well, it won't do anything. You just swim around, look for what it can fertilize. When it can't find anything to fertilize, then it will die off and come out. That's what happens. It's just like even for those who have not done any hysterectomy, it's only one sperm that goes in there. Only one gets apparently gets fertilized. So the rest we just swim around, nothing to do, then they die off and come out. That's my thought. I'm not an expert in that. My
Okay,
specialty is in medication.
no problem. Okay, someone is asking for the sleep therapist contact. Ma, please, if you can, after the webinar, can you drop it on our WhatsApp platform?
Okay, I will. I will.
All right, thank you. Okay, I still have a couple of questions on my end, but if you have any, you can drop it in the chat box. From your experience, what is the one thing that you wish more women knew earlier about menopause and medications?
I wish that women would understand that menopause is not a disease. I wish that women would try to find out what is really wrong with them because I've seen quite a number of women mismanage themselves. They keep treating malaria and typhoid when they don't have malaria and typhoid, like I said earlier. So I wish that women would understand what changes is going on in their bodies so that they can help you because there are some things that we can do, like we listed earlier. We can um, do the right kind of exercise. We can eat healthy. There are so many other things that we can do to relieve or ameliorate the condition. So I just
Thank
wish
you.
that women will understand that menopause is natural. It can set in at any age, so to say, but usually between that 45, 55, 56 will do. Some people have early menopause, so they can seek help promptly. The important thing is to seek help promptly.
Thank you very much. Thank you very much for answering our questions and for also teaching us on every single thing that you have for the slides also. And the information for the contact with the sleep therapist will be shared on our WhatsApp community. Thank you so much for joining us. Yes, even the PowerPoint and the lecture, I could share it. Just join our WhatsApp community and be a part of the conversations that happens there every day, at least five times a week, mostly. Ask questions. She's on the platform, so you can ask her questions and she will answer whenever she's available. Thank you very much for coming to the webinar today. Fortunately, this is where we're going to have to end today's session, and I hope you will join us for the next Menohaven webinar. Thank you very much, everyone. Thank you, Ma.
Thank you for having me.
Thank you, Mrs. Lawal. We really appreciate your time and the effort and everything you put into it. God bless you. And I pray that your business continues to grow and flourish. Thank you very much.
Thank you. Bless you.
And thank you all my friends and sisters on the webinar today. Thank you very much for joining. God bless you all.